Hello and welcome to Total Health with Dr. Nick, where my purpose is to inspire, empower, and motivate you to live longer, healthier, more abundant lives. And guys, today we have a topic that will absolutely change your world. If you can get this right, you can actually dramatically change your productivity at work, your household, your personal life, the school, your kids' relationships, your self-esteem, virtually any way possible. This will impact your life, and that is dealing with ADD, ADHD, and anxiety. Guys, these are crippling problems that will absolutely destroy your productivity, your work. Once again, as I said, maybe your relationships, maybe your marriage, maybe just your life in general. You're struggling and suffering with panic attacks. I feel your pain. I know exactly what you're going through. We've had these patients in our office so many times. We've been taking care of patients with these problems for years. So watch to the end, because we're going to go over our unique approach, how we take care of this, and finally correct these problems, hopefully in many of our patients' cases forever. So guys, just like I said, watch to the end. You're going to learn a lot. You're going to learn the breakthrough technology when it comes to dealing with ADHD and anxiety. So like I said, this affects all of us. In fact, if you really look at statistically, this can affect anybody's families. I don't care if you're rich or poor, and it's really affected my family. I could tell you firsthand that my family's been struck with this. In fact, my son over here, Andre, wonderful kid, great kid, brilliant kid, but this was the kind of kid that, boy, he was like squirrel, shiny objects. He was looking all over the place. He wasn't paying attention. I don't know that I'd label him with ADD. I don't like to label anybody, but I know if he was diagnosed with it at school, they would have said he had it. Because Andre was a type, and you see this many times, and ask yourself this too. Some types of ADD and ADHD, you see a child that's quiet, that's reserved, that just can't focus, that daydreams a lot, that just seems to check out. And then you get the one that wants that attention, wants that adrenaline, is the thrill seeker, that's, rock and rolling, hair on fire, going 100 miles an hour. Well, that's my son Andre, all right? Right now he's into rock climbing. He's getting into possibly competing in the Ninja Warriors, so maybe that served him with that. But when it came to focusing and really putting his focused energy into school, he really wasn't doing well with that. Brilliant kid, like I said, photographic memory, can do amazing things, smarter than you can imagine, but when it came to focusing and actually getting the work done, he really wasn't doing well with it. This is the kind of kid that, once again, impulsivity. He would go down the hill on his ripstick, and for those of you who don't know what a ripstick is, it's basically like a skateboard, but it's got two wheels, and it kind of, wobbles, and you can basically use your hips to get it moving. And he would rip down the hill with this, no helmet. If a car came out, man, I'll tell you what, we would have been picking him up, I hate to say, with a sponge and a spatula, because he would have been all over the road. And I'm like, Andre, what are you doing? What are you thinking about? Why did you do that? And he's just like, I don't know. It seemed like a good idea. Anyway, maybe you can relate to that. Maybe you have like a set of child who's got ADD to where he's just kind of in a daze all the time, in a fog, just checked out. And my daughter here, Ariana, the younger one right here, and by the way, I need to update this picture. My wife keeps telling me, get a newer picture, because all my kids are about her height now or my height. They're all grown up. But anyway, my daughter Ariana struggled because we didn't realize she had a concussion. We had no idea. All we know is that she was coming home from school every single day just wanting to take a nap, and she would sleep for 3-4 hours at a time. Had no idea what was going on. We would go to take her out to dinner, and she'd be having a panic attack, screaming that she didn't want to go out to dinner. Even if we said, hey, let's go out and get some ice cream, she didn't want to do that. She just wanted to stay home and not do anything and just literally stay in her room. And we would, like I said, go to take her out, and she would have a full-blown meltdown, screaming and crying. I mean, one time I had to carry her up to her room, put her back in bed, and just say, okay, just, Daddy's here. It's going to be okay. Don't worry. You don't have to go with us. We're going to go out, and we'll be back, and so on. But we didn't know what happened until we found out that she had gotten a concussion because a boy had kind of pulled her legs, and she slammed her head back either on the cement or the hard ground. We don't know exactly. But my other daughter said, didn't you know that so-and-so hurt Ariana? And we didn't know. It was 4 months earlier. But either way, the signs and symptoms were there. So maybe you guys have experienced this. So what I want to do is really get into what this is all about and why it's so important that you take care of this. And the reason it's so important is because it will infect your lives and affect them in ways that you don't even realize. It's a fact that children and adults that have these ADD and anxiety problems, they're more prone to not finish high school. 33% will not finish high school. They will abuse drugs and alcohol more often. They are more prone to divorce, obesity, Much higher rates, 3 to 5 times rates higher for divorce and obesity, more than 2 to 4 times higher, auto accidents. I could tell you my son Andre, as I said before, all about speed. This kid loves going fast on a motorcycle. And I'll tell you what, I've never seen more crashes happen. And thank God he's okay today. He's all right, but he's had about 5 crashes in the past 2 years. And I'll tell you what, it's got to be because he's going fast. I mean, he's just into speed. He's an adrenaline junkie like that. 33% more ER visits. Like I said, that's him right there. Depression, job failures, and even incarceration. So once again, we've got to get a handle on this. So if you're struggling and you're suffering with this, or you know someone is, make sure you get this video to him. Share, like, comment, subscribe to our channel. But like I said, share this video out to someone that you know that is struggling with ADD, ADHD, or anxiety. It will absolutely change their lives. And I'll tell you what, one of the best things you can do is save, change, and transform the lives of someone else, and you don't even have to risk your own to do it. Now, wouldn't it be great? Save and change someone else's life, and you don't even have to risk your own. That's what it's all about. Anyway, what are the most common treatments for this? Well, of course, unfortunately, we live in a society where it's very drug dependent. It goes right for the drugs. So whether you're taking Klonopin or Vyvanse or Xanax or Prozac or Valium, you're taking an antidepressant or an antipsychotic drug, you're taking a psychotropic drug, you're taking something to try to calm the brain down, some cases stimulate the brain. One thing you have to realize is things like Ritalin are almost identical in molecular structure as cocaine, so it's basically kiddie cocaine. So these drugs, once again, are just treating the symptom. They're not fixing the cause. They're treating the symptom. And worse yet, the last thing you want is a child that thinks they need things like this, or an adult to function. The last thing you want is someone thinking they need some kind of pill, that God somehow created them faulty or broken or incorrectly, that they're somehow less, that they need a pill to be able to function. And that's one of the greatest things we try to instill in our patients, is you don't need these things to be healthy and well, that God designed you to be healthy and well, that it's our natural state. We just have to get peel back the layers and find out what's holding you back from that. And once again, watch to the end. We're going to talk about what that is exactly. But one of the most important things you need to know about these types of drugs is just the side effects. Many times you're not taught this. You might be told that if you give your child something like a Ritalin or an ADHD drug, all they're going to have is maybe, they're going to lose some weight, they're going to have a little bit of weight loss because they're going to have a suppressed appetite. Well, you look at these things, and whether it be an anxiety drug or an ADHD drug, these things have serious side effects like respiratory depression. Can you imagine taking an anxiety drug and getting a coma from it, or death, seizures? And by the way, all I did was go in and write in the physician's desk reference and take the most common side effects of all the different medications that are for ADD, ADHD, and anxiety. Tachycardia, rapid heartbeat, depression. So you're taking something for anxiety and it makes you more depressed as a result. Impaired coordination, libido changes, cardiovascular collapse, right? Can you imagine your heart just stops because you're taking these medications? And once again, your doctor's not telling you this. That's why I'm telling you these things. ADHD drugs, you're looking at anorexia. That's the one you're commonly told. But psychosis, can you imagine taking a drug that causes any kind of type of psychological changes to your child's brain? Biochemical alterations? Stroke? Myocardial infarction, where the heart just stops? Sudden death? And seizures? UTI, Tourette's syndrome, palpitations, blood pressure issues. And once again, if you want to take this, that's okay. I'm just giving you an alternative because so many times you're never told the alternative. You're told one thing and that's it. My job today is only simply to give you an alternative. You choose not to do this, that's okay. But you need to know that there's something else that you're not being told, a more natural, much more conservative way to treat these different problems. And worse yet, many of these drugs carry what we call a black box warning label, which means that these drugs can cause, and by the way, a black box warning is the highest warning that the FDA can issue to any medication because of how dangerous it is. Suicidal thoughts. Can you imagine giving someone something for depression or anxiety and it causes them to want to take their own life? or homicidal thoughts, to hurt someone else, depression, worsening of their depression, psychological dependency, abuse, abnormal behavior, and so on. So once again, these drugs are extremely dangerous, and my fear is your doctor's not telling this to you. You're just hearing the basic side effects. But I'm telling you, these drugs are very dangerous, and you want to avoid them if you can. So how do we break free of this? How do we break free of the bondage of these problems that's crippling your life, that's ruining your personal life, maybe ruining your career? You're wondering why you can't get advanced and get ahead in your career. Your kids are not doing well at school or failing out. Your marriage is crumbling and so on because of the anxiety or the depression or even the, like I said, ADHD and ADD. How do you break free of this? Well, first thing we have to look at very simply is really how your brain works. And how your brain works is very simple. Now, it's very complex, but when you break it down, there's a couple of simple things about how the brain works. It runs off of what we call brain waves. There's different kinds of brain waves in your brain. There's basically 4, although there's more than that, but there's 4 that we'll talk about today. We have beta brain waves, we have alpha brain waves, theta brain waves, and delta brain waves. So each of these is very different speeds. If you think about it like gears in your car or gears on a bicycle, you have slower gears. The slower gears, of course, are for pulling, for towing, for going up or down hills. If you live in a snowy area, you know what I'm talking about. I'm from New York. I know all about driving in snow. You put the car into first gear and things like that. If you're pulling a heavy load, you're in first gear. If you're on the highway, you better not be in first gear or you're going to burn your engine out. You know that. Or if you're a bicycle rider, you know what I mean. When you're trying to go up a hill, you want to be in a first gear. You don't want to be what we call the granny gear, right? You're just spinning, right? You don't want to be in a high gear. Otherwise, you're going to have a tough time getting up the hill. You're going to blow your legs out. So when you're in the lower gear of your brain, you're in deep sleep. Now, as I say, it's the slow gear. It doesn't mean you're not smart. It just means that it's a very low frequency gear. And so in the low frequency, you're in deep sleep. The next speed up, that's called theta. And theta is the kind of gear that when you're waking up from a groggy sleep or someone's, maybe your spouse or significant other is waking you up off the couch and you're going up to bed and you're kind of like stumbling up the stairs like, oh, okay, all right, I'll go to bed. And you're walking up the stairs and you're kind of half asleep, but at the same time you're awake enough to walk. That's when you're in theta. The next one up is alpha, and alpha is you're chilling out. Alpha, I like to say, is the one where you're kind of zoned out, you're listening to soft music, you got, I don't know, maybe an adult beverage or something, you're just kind of relaxing and just chilling out. Or I've experienced this many times myself. You're driving home, you get home, and you pull into your driveway after a long day's work, and you're thinking, how did I get here? I don't remember the drive. I just zoned out the whole time. Or how many times has it happened? Maybe you zone out for about a minute or two on the road, and you're thinking, I don't remember any part of this trip. That's alpha, okay? The fast one is beta. Beta is the fastest, and that's the one I hope you're using right now. If not, get into beta. Anyway, beta is the fast speed, and beta is the one that you want to use when you're in a classroom setting, in a seminar, work environment. We have to be alert and sharp. You want to make sure you're in beta mode, the fastest mode. So here's the problem. Research over the past 40 years has shown abnormal brainwave activity is at the core of many child and adulthood problems. So whenever you have abnormal brainwave activity, so there's abnormal brainwave activity in the delta range or the theta or the alpha or the beta, whenever there's abnormal brainwave activity in any one of those 1, 2, or 3, or sometimes even 4 brainwave ranges, that's when you can have symptoms and when you can have problems. Now, what do we call this? We call this brainwave dysregulation. Now, what is brainwave dysregulation? That means your brainwaves are really kind of scrambled. They're not in a proper frequency, so you can't adapt to your external environment as well. It's almost like thinking your brain is kind of shorting out. So research shows that normal brainwave patterns may become disrupted. And if they become disrupted, that is called brainwave dysregulation, and these can cause neurological symptoms. So very simply, if there's beta dysregulation or alpha, or there's dysregulation in the theta range, it has some very specific symptoms associated with that. And what we see is this. So if someone has delta theta dysregulation, and those two kind of go hand in hand many times, they might have your classic ADD or ADHD type symptoms. You might have problems with being socially inappropriate, Or you might have disorganization or lack of focus, things like that. What if you have a child who has alpha dysregulation? Well, when you have alpha dysregulation or an adult with alpha dysregulation, you see a lot of depression, you see a lot of negative self-talk, rumination, self-deprecation, where they put themselves down a lot. Any of that negative self-talk or avoidance behaviors or agitation or anger, that's your typical signs of alpha dysregulation. And when you have beta dysregulation, that's when you have clear signs of worry, anxiety, panic attacks, restlessness, and what I like to call ADD-like symptoms. And what I mean by that is it's not true ADD, it's not true ADHD. What it is ADD-like symptoms. You don't focus very well, and a lot of times this is what I see patients come in my office with. So a child comes in with the parent, and the parent's thinking that this child's been diagnosed with ADD or ADHD, and the reality is they really don't have that. What they have is ADD-like symptoms, and what I mean by that is this. They show the signs of it, but it's not coming from delta theta dysregulation. It's coming from beta, and the reason is this, is that when you're under, say, an acute stress, say, for example, you get attacked by someone, you're going out to your car and you're about to put your key in the lock or push the key fob and open up your door, and all of a sudden somebody comes up from behind you and asks for your purse. You have acute stress. All of a sudden, it's bam, that stress is right in your face. What are you going to do? Well, there's actually three things you can do. One is either you can freeze, which is what most people do. They panic. They don't know what to do. They freeze. Number two is that they can run, and number three is that they fight. One of those three happens. You hear fight or flight, but it's actually freeze also. Well, that's an acute stress. If that happens to an animal out in the wild and they're chased by a predator, they run away, they jump over a shrub, they hide, they outrun the predator. The predator can't run for so long, and next thing you know, that animal's safe and grazing again. It just forgets about what's going on. Forgets about the fact that it was just chased. It doesn't say, hey, Charlie, did you see what happened? I almost got eaten by that cheetah. That cheetah juked me, it went right or left, I went left. I just got away from it, and next thing you know, I'm out in the clear and I'm good. Whew. It doesn't talk about it with its friends. It just gets over it. What we do is we have chronic stress. And that chronic stress, that chronic anxiety is with us. And then you know what? You ruminate about it. You talk with your friends about it. You blog about it. You write about it on Facebook. You put it on social media. You keep rehashing it over and over and over. And every time you get around somebody, you go out to coffee. You're telling them about it. And next thing you know, it's just that constant wearing at you. That's what you experience. That's that chronic stress. Well, when you have a chronic stress, just as you would have an acute stress, blood leaves this portion of your brain and goes to this portion, your limbic system. So if you're about to be attacked by someone out at your car, you don't think about, oh shoot, did I leave a package at the store when I was at the mall? I can't remember. You know what, I think I might have left something over at Macy's or whatever. You don't think about, oh shoot, did I pay the water bill? No, you're thinking, I need to react, I need to move, I need to freeze, I need to fight, do something. Well, the same thing happens whenever you're in a chronic state, except it doesn't go away. You're in that chronic state forever. So you're in that chronic state, blood leaves here, goes to here, because it's your reflex system, and now you're not making good choices. You're not making good decisions. You're thinking to yourself, what happened at work? I would have never made that decision. How did I let that deal go by? How did I put that answer on a test if you're a kid taking a test? I knew the answer to that. What was I thinking about? And the answer is because you were in chronic stress mode. So when you're in chronic stress, you look like you have ADD and ADHD, but it's not. So this obsessive thinking, this OCD, that's all in beta dysregulation. Now, what do we do about that? Well, here's the problem. When most people are diagnosed with anxiety or ADD or ADHD and things like that, it's all based on what? It's all based on physician observation. It's maybe made by a teacher in a classroom. Oh, your kid's got ADD. Well, how do you know he's got ADD? Well, he just doesn't focus, doesn't pay attention. He fidgets, he daydreams. That's not the way you tell. That's not objective testing. That's just observation. That's subjective. You can't base it on that. The only way to know really what the brain is doing is really to test it. You have to actually test the brain to know what state of dysregulation it's in. Is this really ADD? Is it beta dysregulation looking like it? Why does this kid have this depression? If he's got the depression, do we just medicate it? What's the medication going to do? What's the medication going to do for that ADHD? Really, what it typically does is it tries to ramp the brain up into beta mode so that way their brain is working faster, but it's really not fixing the problem. It's just medicating the problem. This is all just Band-Aid. You want to really get to the underlying cause of why you have your anxiety or why you have the child or an adult with ADD or ADHD. You've got to get to the underlying cause, and you have to test the brain. Now, the way to test the brain properly is with something called a QEEG brain scan. Okay, and a QEEG brain scan looks something like this. We put a cap on our patient's head, and we do this in our office. With the cap on their head, we now can measure their brain waves. We're not guessing at this. It's actually being measured. These sensors, there's 12 different sensors on top of the cap that's reading their brain waves. The brain waves are then going into the computer ribbon that's being fed into the computer software to generate exactly what their brain wave is doing in alpha, theta, beta, delta. So we know exactly what it's doing in every frequency. We know what's high, what's low, what's abnormal side to side, which ones are out of balance, or there's an asymmetry in. We know all this. And so what we then do, once again, we're measuring all the different parts of the brain with this type of brain scan. What we then get is a brain map. Now with the brain map, we know exactly what's going on. So in this case, I changed the name on this girl because when her mom brought her in, she was suicidal. She literally had suicidal thoughts all day long. She would call her mom with panic attacks. She was being bullied at school. So every time somebody would say something to her, she'd text her mom, "Mom, take me out of school. I don't feel good. I'm not feeling good. I've got a stomach ache. Take me out of school." And her mom would get 10, 20 different texts each and every day. Well, when she found out that she was suicidal, she said, "I need to get her in." So she brought her in. And she literally... The mom came in with tears in her eyes. She said, I don't know what to do. I said, "Bring her right in. We're going to get her checked right away." We ran a brain map of her. You could see here, over here in the lower part of the base of her skull. So when we're looking at the map, we're looking at the nose and the base of the skull. So it's like we're looking right down on top of them. The nose is at the top. Okay, we see this low brainwave activity here, right in theta. That's short-term memory deficit. So whenever we see blue, the blue indicates low brainwave activity. When we see over here on this one, in beta, we see it should be all red on this side and all blue on this side. So this whole side in beta should be red. And instead, there's a lot of blue and there's a green. That's going to create the worry and anxiety. Now, we do two different tests. This is done with her eyes closed. When we do it with her eyes open, watch what happens. Everything changes. It gets worse. Everything changes. All of a sudden, this now turned all red. When you have all this red in alpha, that is classic signs for chronic emotional stress, chronic anxiety. So she's under chronic worry and anxiety, which is also leading into the depression, which also makes her want to, unfortunately, harm herself. We see here, all this blue right here. When you see all this blue in beta, that means in beta, all the brain waves are too low. It's very low energy for the brain. When you have all this low energy in the brain in the beta frequency, we see reduced cognitive efficiency. She's not even thinking straight. So all of her thoughts, making decisions, taking tests, knowing when to do the right things, all these things are now reduced cognitive efficiency because of the brainwave dysregulation. Over here, once again, it gets worse. This, as I said before, should be all red on this side, should be blue on this side. Now we have 4 blue. It got worse. So whenever Suzanne opens up her eyes to go to take on the day, she actually gets worse. So now we see worry, anxiety, and ADHD-like symptoms. So all of her problems are compounding as we go on. So what do? We do something called neurofeedback training. Neurofeedback training is specifically designed to correct abnormal brain waves. So we see, based upon the principle that there's normal brainwave patterns and brainwave activity, that the brain can actually be retrained to normalize these patterns. So once again, what we're doing is taking the abnormal brain waves, retraining them, which is what I'm going to demonstrate in just a moment, so that way they can be more normalized, so that way the person can then adapt to situations in their life and their environment better. Because when you have your brain waves all scrambled, you can't possibly adapt to normal situations. You can't do it. It doesn't work that way. So this is what the neurofeedback training, and it's very different than biofeedback. Biofeedback is more, I'm going to be very generalized here, but it's almost more of a physical therapy for the brain or physical therapy for the body. Neurofeedback training is when you directly measure the brain's neural patterns, your brain waves, and then you put as we'll show you in a moment, sensors back on to work and retrain their brainwaves very specifically. So you're actually working with more just the neural connections and neural patterns and neural synapses in the brain itself. So this is what the training looks like. So this young girl is set up over here. She's actually going to start doing the brainwave training. This one screen we see on the left is where she's actually watching. She could be playing a video game. She could be watching a video game, watching a movie. It could be an adult watching Netflix. And over on the right side screen, that's what we see. That's the screen that we're looking at, so we can watch their brainwave patterns. You'll start to see the screen going darker and brighter. And when it's going darker, it means her brainwaves are not in a normal pattern. So we plug the protocols in. That's all plugged in on the right-hand side here. Once the protocols are put in, whenever her brain is playing in the proper frequency or working in the proper frequency, the video plays properly. If it's not in the correct frequency, the screen goes dim. It goes dim, and it goes dim in relation to just how far out her frequency is from normal. Also, the sounds. She's got earphones on. The sounds actually go less in her ears, so she doesn't hear as much. So what's happening is the brain is wanting to correct itself. The brain is wanting to rewire. And as it rewires with what we refer to as neuroplasticity. And neuroplasticity, this is cutting edge neuroscience. It's the ability of your brain and your family's brain to be able to rewire itself, to create new neural connections, new neural pathways. And this is how your brain can fix itself from abnormal brain waves and other types of brain problems. So your brain can actually rewire itself and fix areas. So this, like I said, is cutting edge science, that the human brain has the ability to reorganize itself and create new neural pathways and new neural connections. Now that, like I said, guys, that's groundbreaking. That's how all this works. So this isn't a temporary fix. This isn't something that's a Band-Aid put on like a drug or a medication. We're creating new nerve pathways, new nerve connections. It's almost like saying, hey, after you learn how to ride a bike, you can't unlearn that, can you? Because your brain knows exactly how to do that. There's a saying that taxi drivers in London, because of the fact that the brain, that the streets are so, and my wife was there recently, she could tell you, the streets are pretty crazy in London. Unlike New York City, where it's basically a grid, the roads and the avenues go one way or the other. In London, the roads are all over the place. It's very hard to get around. The taxi drivers have to know these routes very well, so they've developed that part of their brain. Because whenever you, we say in neuroscience, as you fire, whatever nerves are firing are rewiring. So they continually create these new nerve pathways based on what their brain has to know because of their job. So this works for all of us. When you start to learn how to knit, or you start to learn how to crochet or needlepoint, you're not even looking at it anymore. You're just doing it. When you're playing an instrument, you're just doing it. You're not even thinking about it anymore. Because your neural connections are made for that. You're just hardwired for that. That's the way to think of it too. You're newly hardwired. That's why this science, this breakthrough technology works so well for things like ADD, ADHD, and anxiety, because we're creating these new neural pathways. Now, this is what happened with Suzanne. In Suzanne's case, you look at things like her anxiety and her suicidal thoughts. When she first came in, they were extremely high. They were in the range of 9. I mean, could you imagine not having suicidal thoughts in a range of 9? But look what happened. After a few treatments, when she came in, we hooked her up to the system. She played games or watched videos, and next thing you know, we started to retrain her brainwaves and took her out of that dysregulation that was causing her suicidal thoughts. Suicide dropped down to nothing. Her anxiety dropped down to nothing. Things like her worry, initially there was a little bit of a spike, but then it dropped down to nothing. Nothing at all. Why? She was creating new brainwave patterns, getting out of the old negative ones. Not only that, we look at things like her short-term memory problems, improved. Her lack of motivation and concentration, all improved. Simply because we rewired her brain and got it to work more efficiently. One thing I always tell our patients, especially the young ones, is that your brain's not broken. You're not stupid. Your brain just needs to be tweaked a little bit. We need to fine-tune it. God created you perfectly. All we need to do is fine-tune your brain a little bit, and you're going to be fine. And that's what we do with this. In fact, this information, this is so, the efficacy of this type of training has been proven for over 50 years. This was always done at universities. This wasn't even done in doctors' offices at first because if you remember, I'm in my 50s. I know what computers used to look like. They used to take up the size of a room. They were mainframe computers, we used to call them back then. And a mainframe computer was enormous. You couldn't have one of those in your house or your office. So because the technology was so expensive, only universities could do it, and they did all the research on it. Now, doctors, we can do it in our offices, and we can do it a lot more inexpensively, even to the patient. But you'll see here, according to American Academy of Pediatrics, this has now, neurofeedback training has now become a level 1 treatment. That means it's the best there is at treating things like ADD, ADHD. It's a level 1 treatment declared by the American Academy of Pediatrics. Not only that, Harvard University even endorses it. Dr. Frank Duffy over at Harvard University says neurofeedback should play a major therapeutic role in many difficult areas. In my opinion, if any medication had demonstrated such a wide spectrum of efficacy, it would be universally accepted and widely used. So once again, guys, this has been proven. It works. If this is something you're interested in knowing more about, you can contact our office. Okay? I'll put the link down below to our email address. You can email our office. I could find you, maybe someone in your area. You know, I don't know that you could ever come to see us, but if this is something that interests you, finding out how to treat things like ADD, ADHD, and anxiety more naturally, without drugs, and the dangers of drugs and their side effects, wouldn't that be worth it? So once again, you can call our office. I'll put the link for our email address down below. You can also email us and we'll find you someone in your area too. So hopefully this has done something to save, change, and transform your lives. As I said before, if you don't get anxiety and ADD under control, suicide goes up, or ER visits goes up, incarceration goes up. Things like divorce go up, obesity go up. So guys, you got to get it under control. So once again, I hope this was good information for you. If it was, please make sure that you like, you share, comment, and subscribe. And once again, like I said, share to people you know. Get this information to someone you know who's either got a parent or a child who is struggling with these problems, and finally help them turn their life around. And that's really what it's about. So like I said, guys, subscribe down over here, watch our other videos, and continue to watch my channel. Thank you so much for being here. I love and appreciate you. This is Dr. Nick. Have a blessed day. Bye-bye.